Hello, good day. I'm Koen, the application specialist of Schmidt's Medical. I would like to present you the OMF S plate or the ENT plate as the functionality for facial or dental or ophthalmology. The plate, to install it, it's very easy with our easy release system. So you can grab it out. You have left and right, you have hand grips where you can take it out and in, and it's really balanced in the middle, so you can carry it with one hand. And to install, it's very easy. Just plug it in, fix it, and then you will see that it will fix again, and lock itself by our easy click system. Okay, so this is one point. Good. So then installation is done. With the table now, we can adjust the angle of the backrest and the head, because we can now use the table in the reverse mode, and we put up the backrest or down, and we can adapt the functionality here. So we build up the table in the reverse mode because most of the time with facial or dental surgery, the surgeon, he wants to sit from the side or from the head part, but they need a lot of space under the table, because most of the time they are in a sitting position very close to the work field or the surgery field, and then they need to sit and they need enough space. Sometimes they are working with 3 or 2, and then they are sitting from the side both, and then they can sit really close to the table. That's why we cut it also the corners from the back plate, to have a very close approach and to sit very close to the patient. Okay. If there is not enough space, we can also use the translation of the table, to make more space, and to have a lot of space for instrument tables and that kind of things, But the real focus will be on the plate. Okay, so we put the head plate now in a horizontal position, and then what's different with a normal horseshoe headrest or a normal backrest, you have to manipulate a lot of things, and that's why all those functionalities are integrated in the whole concept. So when you sit here, the whole system, the mechanism is not disturbing you while you are working. You can sit very close, and then you have a lot of functionalities that you can handle. You have here a handle where you can arrange the flexion or the extension of the neck, okay? So that you can profile, when you do dental surgery or eye surgery, that you can really focus and that you can create a better visibility of the surgery field, okay, that you can do with this. With this one, you can adapt a little bit the angle, because when you making an extension, you will see it will open the gap more. So to relax the neck, you can adapt the length there. With this one, you can adapt the height of it. So when are you adapting the height? Normally we don't use it that much, but sometimes people has a kyphosis, so a bald back, and then you will see the shoulders are here. When they are here with the bald back, then you will see there is a lot of extension in the neck, and this you can adapt with the screw on the left side. So you can here, you can adapt the height, okay. With the screw on the right, we can adapt the length. This is the fine tuning, because you have another screw here, where you can extend the table, okay. When you extend the table, the back plate, because you will see that the patient is sitting here with the hips, with the pelvis, then we can adapt it to very long persons, and that the table is really adapted. If we extend it in this way, we have an intermediate pad to prolong the cushion of the table. Okay. I fix it again here. Then sometimes, yeah, we need it for ear surgery, or we want working with laser for eye surgery. Then we want to make lateral flexion of the head. So therefore you have the big screw here where we can adapt, yeah, the position of the head, yeah, left or right, or we can even rotate it a little bit when there is some surgery, little intervention on the neck. So what we can do, we can make lateral flexion, rotation, yeah, and then I fix the system here, okay. So it stands like this, and then we can combine it with the other ones, and when you are now in the headrest, yeah, the neck is really in the right position. So this is what you can't do with other tools or accessories of the table, okay. Now sometimes they want to fix the head, yeah, and you see this shape, yeah, it's only supporting the occiput, yeah, but sometimes they want also the fixation of the head because they will work with a laser and they want to avoid that the patient is making some movements. Then we can take off this one, yeah, and we can change it by a support, yeah, with a handle where we can put our horseshoe system on, yeah. So we change the position, yeah, and we fix again here the horseshoe headrest on, that we can change in wide and a little bit less wide, yeah. So it's only a dinner rail we place on it where we can put a horseshoe headrest on, okay. Or in other cases, yeah, when they need only a little support, yeah, that only the occiput is supported, yeah, then we place this roll, okay, on the system, and then only the head is supported. So 3 possibilities, or we have the shaped headrest, we have the back roll, okay, and we have the dinner rail with the horseshoe, and here you can fix a strap, yeah, in this one to fix the head in a certain position. Some cases, yeah, when they have surgery, yeah, I show it like this. Okay, I do know this. They use this one, yeah, also for that you can support, yeah, with your head inside, yeah, when you are in prone position, yeah, it's also possible to use it like this, okay. And when I go on the table, yeah, so now they can support like this. We put the armrest here, and then they can do some intervention from the neck, from the back side, okay. Good. So these are the different movements, yeah. It's up to the surgeon, to choose the length of it. We can make it longer again, yeah, and adapt. And you see, you have always this free space under the table. Good. Now, sometimes they ask us, we need also some arm support for the doctor. Then there are 2 possibilities. Or we use this dinner rail from our existing armrest, our standard one, in combination with our universal armrest. We fix it, and with these joints we can create an armrest, okay. Or a little bit more stability, yeah, we can use a dinner rail extension. We put it on this dinner rail, so we make it longer. We fix it very well. Good. Like this, and this one too. And we take the same armrest and we place it also here. Good. And then we can find the position. We have to go 1 second, like this. So I can adapt the height, I can make it easier, and now when I'm sitting here, I can let rest my arms during my surgery. Yeah, so with this joint, only open one screw, we can adapt, yeah, really the position where you want to be. Yeah, a little bit more open, only one screw. Yeah, and now we have a relaxed neck, and if you can concentrate, you can use these armrests like this.